At Medtronic, we know it's important for you to understand your pain therapy options before making a treatment choice. With the largest number of implantable pain therapy products available, Medtronic offers you hope that relief may be possible. For over 15 years, Medtronic has pioneered the development of therapies that have helped more than 100,000 patients experience the benefits of intrathecal drug delivery therapy. Unlike spine surgery, implantable therapies are reversible. In fact, they can be turned off or removed. And Medtronic continues to develop new pain management therapies and technology with a focus on quality, safety, and reliability. Most chronic pain can be managed with oral medication, physical therapy, surgery, or nerve blocks. But if these therapies don't work or have unwanted side effects, your next step may be to contact a pain management specialist who offers you other options, such as intrathecal drug delivery therapy from Medtronic.
How my life has changed for the better since I've gotten the pain pump is I'm able to maintain my job very actively and not, be in a lot of pain. Everything, my life, driving, cooking, walking. There was a point where I wasn't even able to walk. The pain was so severe.
Well, the things that have improved since the infusion pump, number one, of course, is my free time. I can enjoy my family. I enjoy just doing anything, where I'd come home from work and literally had to go to bed before I had it, even with all the narcotics. So I can enjoy that part of my life. And of course, work is more enjoyable. It's become fun again.
Intrathecal drug delivery therapy consists of a drug infusion pump and a catheter, both of which are fully implanted. The catheter is implanted and connected to the pump, which releases prescribed amounts of medication into the intrathecal space, the fluid-filled area surrounding the spinal cord. Intrathecal drug delivery blocks pain by delivering small doses of medication directly into the spinal fluid.
Goals of therapy are fairly straightforward and simple. First and foremost, pain relief. Second, and equally important, improved functional ability. So you should be able to do things better than you could without this device. So in theory at least, there's better pain relief with less side effects.
Intrathecal drug delivery therapy is not for everyone. A prescription is required. Please consult your physician to determine if an intrathecal drug delivery system might work for you. Physicians have been successfully performing intrathecal drug delivery therapy since the early 1980s, and it has helped thousands of patients with chronic pain worldwide. Intrathecal drug delivery offers significant pain control with a small fraction of the dose that would be required with oral medication. This drug delivery method has been shown to increase pain relief and comfort for people with severe pain. It may also cause fewer drug side effects than oral medications. Before the intrathecal drug delivery system is implanted, a screening test procedure is performed.
Well, implanting a pump is a long-term commitment. It might even be a lifelong intervention. That's what the trial is all about. And during the trial, the catheter will be actually in the spinal fluid. And during that period of time, the patient will need to determine what is the amount of pain relief they're receiving, what are the side effects, if any, that they're having, and how is their function improving? Are they able to do more things and be more active with the device than without it?
Before the screening test, patients also undergo a thorough psychological evaluation.
Patients who have an implanted pump, by definition, have complex chronic pain. And often there are physical as well as psychosocial emotional components to that chronic pain. That's the psychological aspect of chronic pain. That's where the psychological interview comes into play. We need to identify the issues and deal with them separately from implanting the pump.
I was not nervous about getting the pump at all. Because of the opportunity to improve my pain relief, didn't even think twice about getting it to whirl.
Implanting a pain control device requires surgery, and surgery has risk. Your physician will address these risks with you during your interview.
Well, my fear was I'm a little bit vain, okay? The appearance. Clothes fit the same, it doesn't stick out. Those were the things I was fearful about, but it turned to be for nothing.
What I would say to someone who is considering this is, by all means, investigate it as much as you can. It was definitely a good thing for me, and everybody I had researched it through had also said the same thing. It was a great help for them.
The changes that I've seen in Rob since he got the drug pump are remarkable. You could always just see the pain on his face. Now he's starting to relax, seems to enjoy things a little bit more. We all seem to be enjoying things a little more. It was a godsend for us.
Well, as I said, I have a very active job. I'm a restaurant manager. It's nonstop. I could never do that if I didn't have the pump. I would, prior to that, always have to sit down after about an hour. I mean, I was in no pain, and I had not been that way for years. So in my mind, there was no question. This was going to change my life, and it did, and it has, and continues to.
Remember, these patients are describing their own particular experiences. Results vary. Not every response is the same. For further information on Medtronic intrathecal drug delivery systems, or to view other patient experiences, you may visit www.tamethepain.com. Tame the Pain is a public education initiative that creates awareness of chronic pain treatment options and is sponsored by Medtronic. Because intrathecal drug delivery systems are surgically placed, surgical complications such as infections are possible. Device complications also can occur and may require surgery. To understand all the risks of intrathecal drug delivery therapy, it is best to discuss them in detail with your physician. Please refer to the end of this video for a complete list of indications, contraindications, warnings, and precautions. For more information, call Medtronic Patient Services at 1-800-510-6735.